I fell very hard on my face, fractured some bones. I had to get surgery for it. There was a time where I wasn't able to film these videos because you wouldn't recognize my face. The doctor is trying to tell me to not be worried about the surgery, but I was only worried about when can I get back to my sport, to the point where I asked it so much where my surgeon and everyone around actually assumed I was a professional figure skater because I cared so much. I was hungrier than when I was training.
When your body needs to spend a lot of energy to recover the damaged tissue, you spend more calories, so it's normal to feel hungry than the usual.
It felt like that was like one of the only sources of comfort, was like less healthy food. And I definitely didn't stick to a perfect anti-inflammatory diet. So I'm curious, like, what's your reaction? What's your opinion as a professional about that?
This is a vulnerable moment in the athlete life. So yeah, probably you are sad, you're not able to do your activities. So it's normal crave for the comfort foods.
Today, we're gonna be talking about how you can use nutrition to make sure that you get back as strong as possible, as quickly as possible.
Hi guys, my name is Daniel. I'm a BJJ black belt and nutritionist from Nutrion.
And I'm Vanessa, and together with Daniel, we run Nutrion, where we help BJJ athletes and athletes of all kinds to be the best that they can be in their sport. And so for today, we chose the topic injury recovery, because if you've been following along on our Instagram, I've been posting, I had a serious injury doing my sport, which is figure skating. Now almost 6 weeks ago, I fell very hard on my face, fractured some bones. I had to get surgery for it. There was a time where I wasn't able to film these videos because you wouldn't recognize my face. But fortunately now I'm on my way to recovery, and I wanted to use this time to talk with Daniel about, you know, serious injury recovery, what you can do, talk about some things that Daniel has helped me with in the last couple of weeks, and also how I'm going to make sure to get back to my sport as strongly as I can, and maybe some lessons that we can all draw from that. With that being said, let's jump right in.
First of all, I think my experience with injury as well is I have been training jiu-jitsu for 14 years right now, almost 15 years. So I had many injuries, and part of these injuries is chronic, is my fault. So when I talk with athletes about injuries, especially chronic and serious injuries or surgeries, I always like to say the first step is seek a professional help. Many athletes, like me in the past, and a lot of athletes delay to help to seek a professional help. So
like a doctor, right?
Like a doctor, sometimes seek a doctor, but don't start a physiotherapy sometimes. Right. So this is the whole system around be better as soon as, so yeah.
Right.
So this does delay your healing process. So yeah, try to seek a professional help as soon as. Then when you seek a doctor, ask for the timeline that you will be able to return for your activity. Timeline is awesome because you can reorganize your training and competition schedule. Do you have this experience?
Yeah. So this is something I asked my doctor so much about when can I get back to my sport? Like, because this happened while I'm doing my sport, right? So an ambulance brings me to the hospital. They do a lot of tests. They tell me I'm gonna need to get surgery. The next day I'm in the surgery consult, and you know, the doctor is trying to tell me to not be worried about the surgery, but I was only worried about when can I get back to my sport. So he's telling me where they're gonna cut open my face basically, and I'm like, yeah, when can I get back? Like, when can I train again? To the point where I asked it so much where my surgeon and everyone around actually assumed I was a professional figure skater because I cared so much, right?
Yeah.
And I think a lot of people can probably relate to that. Like, even if you're not a professional, like if you're training your sport 4 or 5 times a week, and then obviously if there's a fracture, if there's a surgery, I knew it was gonna be like a while before I can get back.
Yeah.
And I just wanted that while to be like as short as possible, and I was really worried that they would tell me something like, I don't know, 4 months, 5 months. I don't know how quickly facial bones heal.
Yeah.
So anyways, yeah, I definitely asked a lot about that timeline. I think that was really helpful to set expectations, right?
Yeah.
I did get some different timelines from different doctors.
Yeah.
But I think sort of knowing different potential timelines, and then together with that, observing my own recovery, observing how I feel, then I can sort of set the realistic timeline. Because, and actually one more point about timeline. So for example, one of my doctors, he was very optimistic. And he actually had a lot of experience working with athletes. And he said, oh, you know, with your injury, if you feel good, in 2 weeks from now, you can start running again, like going on runs. 2 weeks after the surgery, I was definitely not going on runs. Like my face was still burning so much. Like this whole side of my face was still massive. Like I was happy to be walking. And even walking, I was like very careful. Versus my other doctor was like, oh, like no sport for like a whole month, right? Like a lot more on the conservative side. Yeah, I think that's probably closer to my case, but like light exercise I could definitely do.
Yeah, sometimes there is doctors optimistic and sometimes other doctors conservative. So yeah, but it's always nice to have timeline. It's also you have the both of experience, so it's probably help you a lot to understand, because I love optimistic doctors, but just when you had a surgery, when you pass for the whole process and then you finally are able to recognize what is happening, and you'll be able to return. It's nice to have another opinion.
Because I think in my case too, right? If I only had one opinion, after 2 weeks, I would have been like, my doctor said I can run. Why can't I run? Like, what's wrong with me, right? Versus if I have both opinions, I'm like, oh, I can understand how someone who has maybe a very high pain tolerance, maybe they would slowly be going on a run again. And I can also see how people with a very low pain tolerance would maybe spend way more than a month not going on a run, and then sort of seeing how maybe I fall in the middle somewhere.
After you seek professional help, you should start anti-inflammatory diet and supplements as soon as possible. So what I mean with anti-inflammatory diet is a diet like a Mediterranean diet, so rich in healthy fat like salmon, tuna, sardinia, rich in omega-3. Nice quantities, adequate quantities of protein, adequate quantities of calorie. This is important, calorie and protein, because your damaged tissue recover based on these two things, especially. Of course, not just exactly these two things, but these two things is important.
Even if you're not training because of your injury, you still need protein to
recover. One common mistake is try to lose weight at the same time, then you recover. Don't do that, because you just will delay your healing process. This is two things that the athlete needs to start immediately. So of course with medications and professional treatment.
I know all that, but like going back to sort of what's reality, what a lot of people do and what I did in my case. So I knew about this anti-inflammatory diet and all that, but at the same time, right, before my injury, I was training 4 or 5 times a week. And that has a lot of really positive associations with it. You have a lot of hunger hormones are more balanced. You have more endorphins, you're happier, you know, and so you have a lot less cravings. After my injury, I mean, the first 2 days I couldn't really open my mouth, so I was just drinking some calories, but after I was able to eat semi-properly, I had way bigger cravings for sweets, for anything like less healthy, in my case especially sweet. I think because I couldn't do anything, right? Like before I was walking my dog all the time, enjoying the sun in the morning. I was going to my training multiple times a week. I was preparing for my competition, which was super exciting. And then all of a sudden you have this injury and your plans are derailed, which is sad and makes you crave more endorphin boosting things. But at the same time also, all that like sport, all that movement is completely lacking. So honestly, it felt like that was like one of the only sources of comfort, was like less healthy food. And I definitely didn't stick to a perfect anti-inflammatory diet. So I'm curious, like what's your reaction? What's your opinion as a professional about that?
My opinion is you should do a calibrated diet. So at the same time that you have been eating food, like I said before, healthy fat, adequate quantity of protein, you can eat your comfort foods as well. So sweets, chocolate if you need, especially because I know this is a vulnerability moment in the athlete life. So yeah, probably you are sad. They runs less in dopamine because you're not able to do your activities. Like in your case, walk with your dog, enjoy the sun, do the ice skating sessions. So it's normal crave for the comfort food, especially sweets, chocolates, or whatever. So if you equilibrate this with healthy foods, anti-inflammatory foods, everything will be fine.
Right.
Yeah.
So, and that's basically what I did, right? And you saw what I was eating. So, I tried to focus on whole foods for my main meals. So I'm having, like a proper like rice and fish, or like a pasta with veggies and some other protein source.
Yeah.
But then I definitely ate more snacks than I normally do because I was just having so many cravings. And I was like, you know what? I feel like I'm already being punished enough. Let me have this small joy in my day.
Yeah, I got it. This is normal. Something you can't do is replace, for example, your lunch for a package of gummy bears, for example.
Right.
Yeah, but if you equilibrate the adequate quantity of protein, adequate of quantity of calories with your sweets, it's fine.
And what I also found really interesting with my injury is, so I was training a lot, right? I've gone through phases where I've trained less, like the last year or so, I've definitely been training a lot.
Yeah.
And I've noticed that my hunger is always much higher when I'm training a lot. So I was expecting that after my injury, I'm actually a lot less hungry because I'm not burning so many calories, right?
Yeah.
But in reality, I was hungrier than when I was training, or at least as hungry. Like it felt like I was doing a big workout every single day. Can you talk about that? Like, is that a common thing? Is that what people normally experience?
Definitely. This is normal. There is two separate reasons. So the psychological side and the physiological side. So for the physiological side, when you have the injury or the surgery, so when your body needs to spend a lot of energy to recover the damaged tissue, you spend more calories, so it's normal to feel hungry than usual. The other side is the psychological side. Different people react different. So some people react to with more hungry because of the anxiety to do anything. So you need to do something. So it is a nice behavior to replace the tournament.
Right.
Other people feel less appetizers. Because don't spend too much energy than the training in the day, so don't crave for anything.
Yeah.
So
I mean, maybe it also depends on the injury, right? Because in my case, I had like an injury in my head. I had like probably a mild concussion, and like for example, right, your brain uses so many calories.
Exactly.
So when you're injuring like your head, your brain, maybe then you need more calories versus. I mean, I don't know, I'm not a doctor, so I don't know. But there's probably other injuries where the tissue doesn't need as many calories to recover.
Yeah, exactly. All injuries that the tissue need to be recovered, it's normal the person feel hungrier. So yeah, the calories that you spend per day also increase. So yeah, so not you worry about that.
Yeah.
So
yeah, and it was interesting because again, like for the last, basically 5 weeks, I haven't done any considerable workout, like nothing that I would consider a workout. And I'm back to going on regular long walks, and so I'm very excited about that. But I haven't really done any workout outside of that. And even with all the increased snack food, even with eating like regular portions, I didn't even gain any weight, right? Because your body is sort of still burning a lot even if you're not active. If the reason that you're not active is an injury and it's not, and now that I'm less injured and still not training, I'm actually starting to feel less hungry, which for me is a sign that I'm starting to be ready to get back to working out.
Yeah, makes sense.
Okay, so now we talked a lot about sort of that immediate phase, right, after an injury. So immediately after, obviously get medical help, get your physiotherapy if you need, get your house in order on that side, and an anti-inflammatory diet. But what about later on? So for example, someone who's in my situation, right? So you've waited out the initial phase, you've finished your medication, you've finished the pain cycle, maybe you've finished initial physiotherapy sessions, and now you're slowly ready to get back to your activity. What's your recommendation? How should people think about it and go about it?
Perfect. Let's go back for the second step. Ask the doctor for the timeline. Now, it will help you,
right?
Because this is the phase that you're not completely injured anymore, but you can't back on your activity.
Yeah, you can't go fully back.
Yeah. So it's time to reorganize your goals when you back. What do you want to do? What will be your next event? What will be your next tournament?
But one side note, right? Because this is one thing that figure skating and combat sport are actually really similar. Because if you are in like a contact sport, and like my doctors were very clear that figure skating is also a contact sport, the risk of re-injury is quite high.
Yeah.
And so it's those types of sports where you really need to make sure that you're completely recovered. Like my doctors, they had different timelines for when I can train,
Yeah.
but they had the same timeline for when I can get back on the ice.
Yeah.
Because for me to be able to go back on the ice where I could fall again, where I could break my bone again, for that, the bone needs to be completely healed. They said, you know, it's like in combat sport, you really need to make sure in this case, in this type of sport, that you are fully healed before you get back. It's different than running, right? You can run slowly, you can run a shorter distance, but you can get back to your sport faster. So in these types of sports, like combat sport, figure skating, some other sports, you actually need this in-between phase where your body can handle exercise, but your injury cannot handle your exercise.
Exactly. But yeah, this is my point. So you need to keep eating the adequate quantity of calories, the high quantity of protein, so to be better as quick as possible. So enjoy it to start the workout to gain more muscle mass. When you're back, impact will be less if you have more muscle mass. Try to use some micronutrients, help your body to recover your bones faster, you know, like vitamin D in this case could help with this kind of thing. If you have a reason to do each step of your healing diet process, it'll be easier to do. So you have a reason to take your vitamin D, you have a reason to eat fats rich in omega-3, so salmon, tuna, and sardine, for example.
So now it's the time to sort of look at the calendar, look at some events, maybe still a couple months out, right? I think that's a really great tip. So I think in my case, I'd be looking, you know, now we're in March, and then I'm gonna start training ice skating again in May. So maybe July, August, that could be an interesting event, and that could help me now to already start eating healthy, already work on my body, so that once I can train, I can sort of make the progress that I want.
So there is something that I learned in the UFC course. I'm graduating a couple years ago, but I always like to actualize myself, especially in the combat sports. Nutrition about this subject is really tough to find. So yeah, it's always nice. So something that I learned that is when the athlete is injured, it's always nice work on the weaknesses point before back for your normal activity, you know. So if you are injured right now, if you not feel you are strong enough, start the workout or enjoy the fact that you need to do adequate calories, high protein intake. So it's a time to gain some muscle mass. If you not feel flexible enough, it's a time to train your flexibility. So yeah, it's a opportunity to train it before back to your normal activity.
Right. No, and I think those are definitely 2 points that I'm going to be working on, right? I think flexibility, maybe that's even easier to start off because you can do like lower impact yoga, things like that.
Yeah.
There's a lower risk of injury if you're doing it properly.
Yeah.
And also I definitely need to work on my muscles again. That's kind of what I'm planning to restart, right? Like flexibility, strength. And so you can maybe find the area that you always sort of pushed aside because you're trying to get better on the technical side. I was always trying to work on my technique. And now that I can't work on my technique, I can work on getting my body ready, so that once I'm working on the technique, I can absorb it better.
Yeah. No, I think it's nice talking about the biggest mistakes. So in my opinion, the biggest mistake is, of course, like we explained before, as normal, the athlete eat the comfort foods more than usual because injured and don't have anything to do. But the biggest mistake, in my opinion, is give up of everything and eat a lot of quantities of rich in sugar or fast foods and replace the anti-inflammatory foods, inflammatory diet for this kind of food. Like we explained before, this kind of food is not a problem properly, but the replacements, the completely replacement for
Right.
the anti-inflammatory diet, for fast foods and foods rich in sugar, will delay your recovery. So yeah. So the next mistake, in my opinion, is don't respect the water intake. So in this case, water will help you to reduce the inflammation as well. So you make your body work better, you absorb the medication better. So for many reasons, it's nice keeping your water target. So yeah, this is another point. And the third mistake is rely just in the medications. Diet will be important, medications will be important as well, but rely only on medications is not the best idea to do. So yeah, keep with your diet, keep working on your PT sessions if you need it. Try to relax as much as you can to be better as soon as possible.
Yeah, I think the medications, obviously, they're so important, but they're not like the cure-all. They're sort of one puzzle piece. Like my medications, they were basically like helping me not get an infection and die. And then the other one is just dealing with the pain, right? Like everything else is sort of on me. And so I need to figure out how to actually get better. Like the medication is just to, in my case at least, it was not to not die and not suffer, right? But there's a lot more that I want from my body. And so there's a lot more that I can do. Awesome, that's a great overview of this topic. So I definitely know what I have to do next. So I'm gonna start making sure again that I'm hitting my protein target. I'm gonna be working out more, focusing on the areas that I can. And that's actually gonna help me with my cravings, which are already like way down because I'm already doing, things outside. I'm already walking, so I don't feel the need for other dopamine as much. And is there anything that you wanna tell people that are maybe dealing with an injury right now, that are sort of trying to get back?
Yeah, if you are injured, try to be patient, try to do everything to be better as quick as possible, and not be hard with yourself. So yeah, be chill, wait for your time and recover as better as possible.
You will be back, I'll be back. So we're in this together. All right, and if you are maybe already recovered, or if you wanna see what's ahead for you, we have other videos about cutting weight, about carb timing, about all these interesting things. If you're in physiotherapy sessions, the carb timing especially is still very relevant for you. So check that out, and we'll see you in the next episode.